They are doctors and experts in health, fitness, and nutrition. They use advanced and cutting-edge science and techniques to achieve results that are always efficient, effective, and proven. They improve the lives and function of top professional athletes and executives on a daily basis. They practice what they preach by competing in bodybuilding, Spartan, MMA, and life. They are Team Functionized, and this is the Functionised Podcast. May you be a better version of yourself each day. Live Functionized.
Thank you very much for sending a copy of your book, by the way, Adrenaline Dominance, A Revolutionary Approach to Wellness. That was definitely a fun read, and I appreciated reading that. Definitely a different perspective.
Well, right, between you and me, it should be a Bible for functional medicine practitioners.
Mm-hmm. I fully agree. So many other physicians that I've discussed that don't like to use the word adrenal fatigue so much, but difficulty with adrenaline problems, even thyroid, a myriad of different topics that you discuss in your book are brought up and never treated the right way. So what exactly got you into the ideas that you put into your book, and what made you decide to wake up one day and say, let me put this to paper?
Well, I got involved with hormones back around 1980. My mother died of breast cancer that year. And I realized right after she died that I had inherited her hormones. Most people don't realize that men and women had the identical hormones, different levels, but the same hormones. And because she died of breast cancer, I assumed that she was estrogen dominant and very little progesterone. And the other thing, she had a large waist. She was thin everywhere else. And so I knew that she was overproducing insulin. Mm-hmm. And I know for myself that when I used to drive, I used to fall asleep. I would have to slap my face driving all the time. So I figured I had a little bit too much insulin. And so I thought, well, maybe there's a connection between progesterone and insulin. I started using progesterone cream, and I never got sleepy again in a car. And so that really got me interested in hormones. And I studied as much as I could. I wrote another book called The Miracle of Bioidentical Hormones, which has actually been the #1 hormone book in Germany for the last 10 years. But because I was involved with hormones and I didn't deal with insurance companies, each of my patients, I used to sit down and talk to them for about 2 hours. And when you sit down and talk to patients, you learn about how the body operates. And that's when I realized that they all had something in common, and they had a lot of symptoms related to excess adrenaline. So that's how I got involved with it. Yeah.
Fascinating. You take a different approach. I mean, most people don't think about rubbing progesterone, the bioidentical progesterone, as opposed to slamming Red Bulls when you're tired driving at night. How's your approach typically different when it comes to the idea of adrenal fatigue than a lot of other physicians?
Well, the interesting thing is actually adrenal fatigue doesn't exist. It's
right.
And it's a naturopath diagnosis. And the reason why naturopaths diagnose it is that they basically use saliva tests to determine hormones. And the thing about adrenaline is a survival hormone. And part of the survival response is that it cuts off blood supply to areas of the body not needed for survival. And the salivary glands are one of these areas that it cuts off blood supply to. So because the hormones don't get into the saliva, when there's a lot of adrenaline, you get a low cortisol level. And based on the low cortisol level in the saliva, that's how they diagnose adrenal fatigue. If they did a blood test, they would find that the cortisol level was actually high. But the whole approach to adrenal fatigue is to try to bring up cortisol levels when they're already high to begin with. And cortisol is not a happy hormone. Not only does it cause weight gain and osteoporosis, but it also, impairs the immune system. And this is not a good time to have an impaired immune system.
No, I mean, typically right now, especially throughout time. Those with impaired immune systems are suffering a lot more. But even when there is no pandemic moving around, what are some conditions typically caused by excess adrenaline?
Well, the first thing people will notice, they'll have trouble sleeping at night. May have trouble falling asleep. They'll have trouble staying asleep. They might grind their teeth, toss and turn, restless leg syndrome. Some people get up at night to urinate. This is all excess adrenaline. And but the other conditions, ADHD is excess adrenaline is the only cause of ADHD. Fibromyalgia is, there are 10 million people in this country with fibromyalgia, and that's also caused by excess adrenaline. And other conditions, road rage, anger, is adrenaline. Bedwetting in children is only caused by excess adrenaline. Irritable bowel syndrome, tinnitus, PTSD, PMDD, is caused by excess adrenaline. It goes on and on. A lot of conditions caused by excess adrenaline.
Your book. Go ahead.
Okay, I was going to say, and two other things. Anxiety. Basically, the only cause of anxiety is excess adrenaline, and it's probably the number one cause of weight gain. And believe it or not, there are a lot of people concerned with weight. And this is weight that comes on while they're sleeping, and I can talk about that later. So.
Oh, absolutely. We'll definitely get into that in a little bit here. Adrenaline Dominance, your book. It's kind of the Bible, if you would. Do you recommend individuals seek care of another physician, or can they kind of do this on their own here?
They can absolutely do it on their own. That's why I wrote the book, because as you probably know, doctors are not trained to treat the cause of illness. They're basically trained to give out Band-Aids. And when it comes to excess adrenaline, this is a concept that is unknown to most doctors. In fact, probably almost all doctors. And so, but the book explains why people have a lot of adrenaline and the conditions associated with it. And just as importantly, how to lower adrenaline very quickly, naturally.
How long do you think it may take typically if somebody starts following your advice, protocols, and lowering their adrenaline levels to start feeling any differences?
Well, let's say somebody had road rage, which is only caused by excess adrenaline. 24 hours, it's gone. I mean, that's how quickly you can lower adrenaline. Even bedwetting in children, you get rid of in 24 hours. ADHD, you can get rid of in 24 hours. So it doesn't take long to get better.
No, and typically these symptoms are combated by pretty excessive drugs at times, including ADHD, which oftentimes is increasing adrenaline even more so until somebody kind of burns out, typically, as they feel they're so exhausted.
Well, you're absolutely right. If somebody doesn't have ADHD, these drugs will give it to them. Ritalin, Dietary, Adderall, they all increase adrenaline levels.
Why is awareness of the role of adrenaline in our lives typically should be more newsworthy than it currently is? I mean, we're currently very complacent. I don't mean you myself, but the world as a whole is very complacent in what's been said and what's been given and mainstream. So why exactly should awareness become more noteworthy and newsworthy here?
Well, I guess primarily so people can get better. Right now, prescription drugs are the third leading cause of death, and for a lot of conditions related to excess adrenaline, people are on prescription drugs. Mm-hmm. So so one of the main reasons for people becoming more aware is that they can get off certain medications. They can actually control their health. They don't have to rely on other people, doctors, to get better. And especially now, adrenaline is probably the only cause of stress and anxiety. And when people are under stress and have anxiety, the body releases another hormone called cortisol. And again, cortisol, impairs the immune system. So just by lowering adrenaline, you could actually put yourself in a better position to not have problems related to COVID-19. It won't prevent it, but it'll help your body fight it better.
Absolutely. I mean, I've been preaching for a long time, creating a very inhospitable environment for any type of pathogen. And if your environment is hospitable and welcome it in, then you're more susceptible to get something, right?
You're right. Yes.
Why do you think we never really hear about the role of adrenaline in disease when it comes to talking with our regular physician?
It's probably the hardest question that I have to deal with. I don't understand why doctors are not really aware of adrenaline. The book Adrenaline Dominance that I wrote is the only book ever written that talks about the clinical consequences of too much adrenaline. I'm not a big fan about drug companies, and I think that they control a lot about what doctors learn and know. And frankly, drug companies do not want doctors to know the underlying cause of illness, because if you treat the cause of illness, you can eliminate it. And that's the last thing that drug companies want. So, I don't want to sound a little bit paranoid here, but drug companies control a lot about medicine, and they have, little interest in people being well. That our whole medical system thrives on disease and illness. It does not thrive on wellness. And as you know, there's no preventive medicine in this country. They won't allow it. So,
not profitable, unfortunately.
Yeah.
So much.
So,
what do you think we can do to help change the mindset of both the general public and the medical community as well to treat the causes instead of the symptoms?
Well, that's why I enjoy being on podcasts. I'm trying to get a message out there. There was a time that I wanted to change medical care in this country, but you run into a lot of obstacles trying to do that. I even approached, believe it or not, functional medicine schools about adrenaline. They had no interest. So I try to do the best I can. The books I've written are written for the public, to teach them about how their body operates. And so I think probably perhaps the main approach is just to educate the public. I try to educate doctors, but I think,
educate the doctors as much as you can. One of the things I found is once a physician is kind of ingrained in their ways, that's it. It's kind of over. It's very difficult to get through. But getting the young generations coming out of school, that's certainly a lot more impressionable. I'm definitely finding out along my ways, at least.
Well, that's great. I don't have contact with those people, but I'd like to. So.
Well, definitely with this podcast here, I'll be blasting out to a lot of the younger generation.
Okay.
And hopefully they'll leech on as well, too, to get your message across here, because I think it's an amazing message. And a lot of individuals that we see here, it just was kind of eye-opening, realizing they have adrenaline dominance. We can treat it the best we can using nutrition, but some of the different techniques that you discuss in adrenaline dominance really have hit home. And I know a lot of people are going to have vastly improved daily living. So amazing.
The see, one of the treatments, as you know, is the use of a 5% strength progesterone cream.
Mm-hmm.
And the reason why 5% means each pump is 50 milligrams. And that's the exact strength you need actually to block adrenaline. And but we're dealing again, most doctors think that progesterone is a woman's hormone, and they don't realize that men and women have the identical hormones.
Mm-hmm.
So it's an important hormone for men and women. And also, you may have heard of babies that have colic.
Mm-hmm.
That's the first, evidence of excess adrenaline. And you take some progesterone cream and rub it on the baby's belly. It goes away in about 3 minutes. So mothers don't have to stay up all night with a crying baby. And bedwetting in children is only caused by excess adrenaline. And instead of, children having to deal with that for years, you can get rid of that in 24 hours just by lowering adrenaline. And I look at all the children, the millions of children that are on drugs for ADHD, and you get rid of that in 24 hours. And if you don't mind my elaborating a little bit, the whole thing about ADHD, doctors and schools don't understand. It's not a learning disorder. It's actually an interest disorder. People with ADHD are the most intelligent, successful, creative people in the world. In fact, most doctors have ADHD. I certainly had it when I was in school. And in fact, the most successful people in the world have two different types of ADHD. And by that, I mean, people are aware that kids with ADHD are hyperactive, but then you have other kids that have trouble focusing in school that are not hyperactive, and they call that ADD. Mm-hmm. So the most successful people have a combination of ADHD and ADD. And the ADD people are the ones that are creative, and actually creative people have the most adrenaline. But the heads of every major corporation have two different types of ADHD, and probably not one of them ever finished college. So the ADHD is not a bad thing to have, and it certainly does not deserve being put on psychoactive drugs. Just a matter of just lowering adrenaline.
When it comes to progesterone, which obviously is different than progestin, which a lot of physicians want to prescribe, at 5%, where do individuals typically get this? Is it prescribed? Can you get it over the counter? And if it is prescribed, if the doctor doesn't want to prescribe it, what do they do?
Well, luckily, people can get 5% progesterone cream over the counter. You can get it on Amazon. You can actually get it on my website. I had it specially formulated. You don't need a prescription to get the strength of progesterone that you need to block adrenaline. And I had a patient that came in to see me. He was about 47 years old when he first came in. And the reason why he came in is that every morning he would wake up and vomit. And the only thing that'll cause that kind of vomiting is excess adrenaline. And he had severe fibromyalgia, which is also caused by excess adrenaline. So I placed some progesterone cream on his forearms, and he rubbed his arms together. And we started talking again. And about 5 minutes later, he sat back in his chair and he said, "Doc, in my entire life, I've never felt this good." That's after 5 minutes after progesterone cream. And and he never had another episode of vomiting after he left my office. And needless to say, his fibromyalgia went away also. So, progesterone cream, it's important, but not as important as nutrition when it comes to lowering adrenaline, because the whole approach to adrenaline is to treat the reason why the body is putting out adrenaline. Mm-hmm. And what makes it relatively simple, there's only two reasons why the body releases adrenaline. One is if you're in danger, but most people do not live in a war zone, and it's unusual for them to be exposed to danger. The most common, or the most important reason why the body puts out adrenaline is that the body uses adrenaline to make sure the brain has enough glucose, sugar. And most people do not realize that the brain uses more glucose than any other part of the body for weight. And anytime the body detects a drop in glucose, the body puts out adrenaline. And there's some people that live on adrenaline all day and all night because, again, they're not providing fuel to the brain. So the body does it by just putting out adrenaline. And, adrenaline peaks at 2:30 in the morning because the brain runs out of fuel then. And a lot of people get up at that time to urinate because adrenaline gives people that urge to urinate, even during the day when people have to go and, and run to the bathroom. That's adrenaline. And some women lose urine on the way to the toilet, and they call that urgency incontinence. And some women are getting Botox injections in the bladder to treat this, which means for the next 3 months, they're going to have to catheterize themselves every time they want to urinate. But you can get rid of the urgency in 24 hours. It's just a matter of treating the cause. So the brain uses two different fuels. And one of them is glucose. And the best source of glucose for the brain comes from vegetables. Mm-hmm. And the reason for that is that vegetables do convert into glucose, but they don't stimulate a lot of insulin. So they're low glycemic. Candy and soda are great sources of glucose, but they stimulate a lot of insulin, which lowers sugar to beat the purpose. And then the other fuel the brain needs are ketones. And, some people go on a ketogenic diet, which I don't recommend because it's a hard diet to master. You can get that from coconut oil and MCT oil.
Mm-hmm.
And so these are, so the vegetables, the MCT oil, coconut oil, and progesterone cream, you don't need to go to a doctor to get started on getting better.
Do you find individuals that are on a ketogenic diet or lifestyle may have higher levels of adrenaline because of lack of glucose, or do you think it kind of is a wash in that case because they are running off of fuel?
It's a very interesting point you bring up. Again, the ketogenic diet does provide part of the fuel that the brain needs, but again, the main thing that the body's interested in is making sure the brain has glucose. So people even on a ketogenic diet may still have problems with adrenaline. And then you have people that do a lot of exercise, and people have to understand that muscles burn glucose just like the brain burns glucose. And so very often people that do a lot of exercise actually still gain weight because they're gaining weight while they're sleeping, because that's when adrenaline peaks. Mm-hmm. And when the body releases adrenaline, it creates stress to the body, and the body responds to that by putting out cortisol. And the first thing cortisol does, it also raises glucose levels through a different process. So while people are lying in bed, they're putting out two hormones that raise sugar levels. And I suspect, and I'm pretty much convinced, that adrenaline is the number one cause of weight gain. And it happens while people are sleeping. And this is why people can diet and exercise during the day, but gain weight while they're sleeping and not lose any weight.
Mystery solved with a lot of individuals there who are just beside themselves because they exercise. They believe that they eat right, and just nothing is coming off.
Yeah.
So very good idea to delve down into. When it comes to go to ADD, ADHD, typically children are diagnosed with it. Is there an age limit where progesterone should not be used, or do you feel it's safe for pretty much everybody?
It's actually, I recommend it for babies that have colic, and giving hormones to children is almost unheard of in the medical community. And I don't understand that because, hormones control every system in the body.
Right.
And the thing is that when the fetus is in the womb, it gets exposed to incredibly high levels of progesterone, levels that cannot be duplicated. So if the fetus can tolerate extremely high levels of progesterone for 6 months, a baby can tolerate just a little bit of progesterone for, so progesterone is safe at any age. It's good for both sexes. It's not a sex hormone. It won't delay puberty. It virtually has no side effects. In other words, you can't overdose on progesterone. And I will give one caution about progesterone. You may have heard of a condition called type 3 diabetes.
Yes.
And, it was interesting. They don't have a way to diagnose that. But what's important about type 3 diabetes, which is insulin resistance in the brain, is that it's probably the number one precursor to Alzheimer's. In fact, some people refer to Alzheimer's as type 3 diabetes. And you may have heard that coconut oil can actually cure people with type 3 diabetes or people with Alzheimer's. And the reason for that is that what's nice about ketones, they go directly into the brain. They don't need insulin. Now the thing is that when people have insulin resistance in the brain, if they have it, and they use progesterone actually creates some degree of insulin resistance, which is a good thing because it prevents people from getting sleepy when they're driving or sleepy in the afternoon when insulin peaks, which is good. But if you already have insulin resistance and use progesterone, it increases it. So almost immediately they have increased symptoms of adrenaline, palpitations, tension, anxiety. And so it's actually a way of diagnosing type 3 diabetes, which they don't have. And so once you know that you have insulin resistance in the brain, you can actually do things to prevent it from converting into Alzheimer's. Or if people actually don't have insulin resistance in the brain, but they have no fuel in the brain. Again, progesterone can do the same thing. So it just wakes people up to the fact that they need to change their meal plan. Vegetables, coconut oil, MCT oil.
So what would you say to individuals, which I'm sure you've heard before, that say, I need sugar? Don't you need sugar to live? And then they will go out and put sugar in cereal. They'll have a Gatorade or something like that full of sugar.
Let me tell you, people that crave sugar are usually the ones that have the most adrenaline, because the brain craves sugar. But if you give the brain the fuel that it's looking for, glucose from vegetables, and MCT and coconut oil, that craving should disappear. So.
Any particular type of vegetables, or pretty much?
Well, you have what are called green vegetables,
mm-hmm.
and the asparagus and the spinach and whatever, and green vegetables are like zero glycemic. They don't produce any insulin at all, and that's why they're so good for when people are trying to lose weight. They can eat as many vegetables as they want and not gain weight. But but any kind, now there are certain vegetables like white potatoes that are high glycemic, which means that they produce a lot of insulin. Mm-hmm. And however, you may be familiar with something called resistant starches. Mm-hmm. And cold white potatoes are resistant starches, which means that they're okay to eat. For example, you're allowed to have potato salad because it's cold, or white rice with sushi if it's cold. But otherwise, those are the kind of foods that one would want to avoid. But basically, most vegetables are okay.
When it comes to, getting me thinking vegetables and wild yams and progesterone here, is wild yam and progesterone one and the same? If someone's looking at, I've seen on Amazon progesterone cream, and all it is wild yam. So is there a difference?
Yeah, there's a big difference. Wild yams can be converted chemically into progesterone, but wild yams by themselves will not convert in the body into progesterone. So wild yam extract cream does nothing. It won't produce any progesterone at all. But progesterone is either based from wild yam extract or from soy. Wild yam is preferred because a lot of people are allergic to soy, and a lot of soy is genetically modified now. So
what have you been doing previously, and what would you like to do in order to get your message out, get your Bible of adrenaline dominance out more to the world so it can be more widely understood? I mean, paradigm shifts are very difficult. It's met with a lot of resistances, at first, and then there's some anger, violence, if you would, before people finally start to come the other way. So what have you done, and where would you like to go?
Well, about 10 years ago, I surrendered my license. Mm-hmm. And the reason for that is that the doctors in my community complained to the medical board that I was taking their patients off their medications. And I was doing that because when you treat the underlying cause of illness, they don't need drugs. Right. But that's a real slap in the face to doctors, because that's all they know is to give out drugs. Mm-hmm. So the medical board got interested in me because, first of all, they're funded by drug companies. And, but the problem is they couldn't investigate me because they never had a patient complaint. Right. So they sent in undercover patients to falsify and initiate complaints. So once they had the complaints, then they went after me probably more aggressively than any other doctor ever in California. Even though I've never harmed a patient, and they never had a complaint from a real patient. And what the main concern of the medical board was that I was taking people off drugs. And I refused to stop doing that, because I didn't want to change the way I was practicing medicine. So just to get them off my back, and let me tell you, I spent $500,000 trying to fight these people. I surrendered my license. And even though that still didn't stop the medical board from coming, they're just in my office 2 or 3 weeks ago for 13 of them dressed up in their police uniforms. Drug companies control a lot, so that's why I say it's hard to get the message out when you come up against these obstacles. So I rely on people like you to get the message out.
Easy enough. So what is your email? How can people get a copy of your book? And if people have questions directly for you, how can they get in touch with you?
Okay, well, I'm sort of semi-retired, so I'm very easy to get hold of. If they call the office number is 760-836-3232. Mm-hmm. My website is www.plattwellness, plattwellness.com. My email is questions@plattwellness.com. They even have like a hormone evaluation that you can take, and I go over with them once if they want that. So I'm pretty much available to answer questions.
Okay.
Medicine has always been a passion for me, and getting people well, it's very rewarding, and unfortunately, doctors don't see it very often. There are questions that doctors should have. They should be asking, why is it that some women vomit throughout their entire pregnancy? Mm-hmm. And actually, you only see that in creative type women. And again, because creative people have the most adrenaline. But once you know that it's adrenaline, you can fix it. Bedwetting and colic and ADHD and fibromyalgia, doctors consider it incurable. And I tell people with fibromyalgia that if they're going to have chronic pain, it's the best thing they can have because it's the easiest pain condition to eliminate. Mm-hmm. So it shouldn't be like this. That people have to read a book to try to get better. These are things that doctors should realize. It changes your whole way of approaching medicine when you can sit down and get people well instead of just writing out a prescription, which is just a Band-Aid. I don't want to sound like I'm on a soapbox here, but I enjoy, like I say, medicine is a passion for me, and I enjoy it. So,
if you've got a passion, I always say to our listeners and everybody I come across, follow your passion, because you'll never work a day in your life. You'll always love what you're doing, and you're probably going to be pretty darn good at what you do if you're following your passion. So I thank you very much for following your passion, Dr. Platt. And you've definitely made a difference in my life with your book, Adrenaline Dominance.
Okay, well.
And we're definitely blasting this out and utilizing it with those around us as well. So
okay.
I certainly appreciate you being with us here afternoon.
It's certainly been my pleasure. Excellent.
Thank you very much.